everyone, thanks for tuning into today's TEDx talk on person-centered healthcare. Today, we're going to be focusing on the prerequisites of healthcare professionals that focus on the skills and capabilities of a registered nurse. The prerequisites of the healthcare professionals are very much the building blocks of the framework for person-centered nursing, developed by McCormack and McCants. These are the skills and capabilities that are instilled in each practitioner to give them the tools to practice holistic and effective healthcare. We will also be looking at the role this care model plays in enabling nursing leadership and in developing the nursing profession. Firstly, let's have a look at what person-centered practice actually is. Person-centered care is a model which changes the focus from the diagnosis to the patient and places the patient at the center of the care. As defined by the World Health Organization, people-centered health services is an approach to care that consciously adopts the perspectives of individuals, families, and communities and sees them as participants as well as beneficiaries of trusted health systems that respond to their needs and preferences in humane and holistic ways. People-centered care requires that people have the education and support they need to make decisions and participate in their own care. It is organized around the health needs and expectations of people rather than diseases. This approach to nursing care considers factors such as the patient's values, culture, community, ethnicity, religion, and lifestyle, all important components to the individual's overall health. Evidence has suggested that person-centered care improves health outcomes and health access for patients. Person-centered care can be achieved by involving the patient in the decision-making process. A successful person-centered care approach provides compassionate care while ensuring the patient is in the center of the care by catering to their individual needs. There are many components that need to be laid out and explored in the foundations of teaching in order for practitioners to deliver better person-centered care. As Welch notes, identity involves a person's sense of individuality. Identity implies being distinct and separate from others, being able to view oneself as a unique individual. How we feel and what we think about ourselves is important as it affects the way we care for ourselves and others physically, emotionally, psychologically, and spiritually. Throughout our studies thus far, we as a group have learned the importance of recognizing ourselves as emotional beings and health professionals as one and the same. Person-centered care is a model that encourages nurses to see themselves as both, while treating people with the respect, individuality, and dignity that we as emotive beings would like to receive in all aspects of life. Once we recognize that each person is unique and that their individual needs and values may differ from yours and others, we can then provide the best possible person-centered care for that individual patient. It is not simply about treating everyone the same. As culture greatly influences what people value in life, it is essential to carry out culturally safe care. As health professionals, we need to be aware and recognize the significant role culture plays in a person's health and well-being. McCormack and McCants initially developed the framework for person-centered nursing in 2006, and it has been reviewed and evolved with evidence-based theories since then. The prerequisites are the outermost layer of the framework. In order to achieve a person-centered healthcare environment, a nurse must have the following key attributes: professionally competent, developed interpersonal skills, commitment to the job, clarity of one's own beliefs and values, and knowing of the self. Being professionally competent in this model of care encompasses knowledge, skills, and attitude to provide a holistic approach to healthcare. There are several requirements prescribed by the Nursing and Midwifery Board of Australia in the Standards for Practice, which states that as a regulated health profession, registered nurses are responsible for their professional development and contribution to the development of others. They are also responsible for providing information and education to enable people to make decisions and take action in relation to their health. These standards are regulated by the Australian Health Practitioner Regulation Agency, which also tracks and ensures continual professional development and education through the CPD scheme. Professionally competent nurses are better able to aid their patients in shared and informed decision-making, which fosters a culturally safe and person-centered healthcare. Having highly developed interpersonal skills plays a vital part of building trusting and therapeutic relationships with patients, meaning that both verbal and non-verbal communication must be professional, warming, and culturally safe at all times. According to McCormack and McCants, poor communication is linked with increased patient and family vulnerability. This is due to the barrier it creates in building a therapeutic relationship which allows for shared decision-making in a trusted environment. The importance of emotional intelligence is also stressed by McCormack and McCants in the context of placing and revealing yourself as a health professional and as an emotional being in order to respond effectively to emotional behavior. The prerequisites of having interpersonal skills and knowing of the self are associated closely due to the emphasis on emotional intelligence. Knowing of the self is another key component in achieving person-centered care. Our own self-awareness and self-knowledge contributes to how we develop relationships and engage with others. The process of self-reflection in a critical manner is an excellent method of furthering our own awareness and encourages an inclusive and holistic stance to practice by enabling the nurse to view themselves and others in various contexts including physical, social, and emotional. Additionally, this creates movement towards more culturally safe practice in becoming more mindful of social contexts and valuing others as individuals in a holistic sense. Although this journey of self-knowledge may be difficult at times, health practitioner discomfort should not inspire inaction, as it is through applying critical, creative, and ethically reflective operations that we transform our future actions. The framework identifies and demonstrates a clarity of one's own beliefs and values as a necessity for working within the care environment. It is important to discover what your own personal values and beliefs are through self-reflection and to consider how these fit into the values of the nursing profession as encompassed by the NMBA's Code of Conduct for Nurses. The inclusion of values and beliefs in both the framework and the Code of Conduct demonstrates the aim of nurse leaders to create an effective workplace culture where specific person-centered values are shared. Commitment to the job, as explained by McCormack and McCants, is more than going the extra mile as the typical societal expectation of nurses hold. It is about each action and word being deliberate, mindful action, supported by various evidence-based literature. It should be noted that this level of commitment needs to be supported by the values and philosophies in each care environment. Strong leaders can be attributed to promoting this part of workplace culture. Another important aspect of the prerequisites of healthcare professionals, focusing on the skills and capabilities of the RN, is analysing the leadership challenges in the real world of practice. According to the Nursing and Midwifery Board of Australia, registered nurse practice is focused on person-centered care as well as evidence-based with preventative, curative, formative, supportive, restorative, and palliative elements. The nursing profession faced the greatest challenge on identifying and developing leadership roles. Together with increasing demands for access to care, consumer expectations, a mandate to improve person-centered care, and concern with levels of quality and safety of healthcare, researchers conclude that the importance of effective clinical leadership in ensuring a high-quality healthcare system that consistently provides safe and efficient care has been reiterated. To be able to identify the leadership challenges for registered nurse practice in the real world of practice and those who are involved in person-centered care, a group of student nurses undertook research that looked at leadership challenges to advance the nursing profession, leadership development, and consequently become a role model of nursing. We then must look at: what is leadership? Leadership is derived from the action of a leader who has the capacity of leading a group of people or organization to accomplish a specific goal. The nursing profession and the concept of healthcare leadership requires engaging through education, training, and life experiences. Furthermore, identifying challenges that interfere with leadership in clinical and person-centered care is such a key prerequisite and foundation to better the nursing profession. These challenges include, firstly, poor preparation of leadership roles and interdisciplinary relationships. Registered nurses must be aware of the accountability, criteria, and delegation of their roles as a leader of a professional team. Therefore, this develops the understanding of their strengths and limitations as well as creating a positive practice environment, effective characterized teamwork and leaders, managing generational, hierarchical, and cultural gaps, and consider the important factors when delegating to non-nursing staff. For example, leading by inspiring, enabling, and motivating rather than dominating. Effective formal and informal communication processes that are transparent, expectations about performance, and reporting. Secondly, poor communication skills should be a primary concern in the nursing profession. The use of poor communication in the nursing profession not only inhibits the development of trust and damages an existing trusting relationship, but it can also act as a barrier of therapeutic relationships which could lead to unaccomplished goals. Registered nurses should be aware of barriers that could impair effective communication in healthcare settings and lead by example. Moreover, lack of confidence and incentives. Registered nurses must adhere to their scope of practice and competencies that are required by law. This therefore means that a registered nurse must undergo the essential training and education necessary to be competent in practice. Registered nurses must be task-oriented to undergo specific tasks related to nursing across a group of clients and multidisciplinary team members to gain confidence and skills that adhere to evidence-based practice. Furthermore, inadequate resourcing of development programs means that registered nurses will continue to delegate to ensure continuous improvement and advancing in the nursing profession. This means a better vision and commitment at the high level through engaging in learning education programs. A paper produced by the Australian Commission on Safety and Quality in Healthcare discussing patient-centred care and its ability to effectively and holistically treat patients made the following recommendation. Patient-centred care should be a component of undergraduate and postgraduate educations for all health professionals. This recommendation has provoked the National Safety and Quality Health Service Standard Commission to update accreditation requirements to include the need to improve patients' quality of care by focusing on patient-centred practice. As evidenced by this subject, universities have utilized practicing nurses as lecturers and tutors to provide current real-world education to undergraduate nurses in an interactive, hands-on learning environment. The Australian Institute for Patient and Family-Centred Care was formed in 2009 by Dr. Catherine Crock to support a patient-centred philosophy for postgraduate nurses and patients alike. It recognises the role of healthcare professionals, patients and families as partners and the significance of patients having a real voice in planning and implementing their own healthcare management. The AIPFCC provides a 4-day training package and mentoring program in family and patient-centred care to support and educate currently practicing healthcare staff. On a day-to-day level, hospital initiatives to improve patient-centred care can be seen through the introduction/use of bedside handovers. Despite some initial hesitation from nurses to involve patients in handover for fear of disclosing confidential information and privacy in multi-bedrooms, it has been seen that this patient inclusion leads to a more positive patient progression and the want to get better. There is much work to be done to help health and social services to be more person-centred, and this has become more of a priority over the past decade. It has been shown that putting people at the centre of their care will improve the quality of the services available, help people get the care they need when they need it, help people be more active in looking after themselves, and reduce some of the pressure on health and social services. But achieving a person-centred style of care is as much about the education provided as the attitude and mindset of the healthcare professionals themselves. We as future nurses need to make the conscious decision to recognise our patients as individuals requiring personalised and holistic care. From this, we hope you take away useful skills and knowledge to put into practice in your future nursing careers. Thank you for listening.